Welcome back to This Week. I'm pleased to be joined by Peter Rosenberger. He is the author of this book, Hope for Caregivers, and it really, welcome first off, sir. And it really does emphasize one of the not much talked about issues regarding this whole opioid epidemic that's nationwide and here in Tennessee, caregivers, and how dealing with opioids, dealing with someone in chronic pain, it's really a big part of this problem. Tell us your story. You've been dealing with your wife, a caregiver for your wife for 30 years now.
She had a terrible wreck when she was a freshman at Belmont in 1983, massive orthopedic trauma. And to date, actually as of 2 weeks ago, her 80th surgery, both legs amputated. I married her a couple of years after the wreck. I didn't know her at the time. We didn't know how bad this was going to end up being. And over these years, it has just been a medical nightmare. Now, she's had seasons where she's done very well, but she's never been well. And I've learned the hard way that if you're treating somebody for chronic pain, it's a family issue. And if you exclude the caregiver from treatment of this, you are running the risk of hurting the patient as well, because if caregivers are not in a good space, what's going to happen to their loved one? Financially, emotionally, physically, whatever. Go down the list of all the things. And so I've been watching this unfold on a national level, and I said, you know what? No. I'm going to raise my hand and say we've got to talk about caregivers in this opioid crisis because it's affecting us. 80 plus doctors, almost 100 doctors now, I keep losing count with my wife, have written prescriptions for her over the years. And never has one of them ever looked across the prescription pad and said to me, dude, we're putting a lot of chemicals in her body over a long period of time. You might want to get some help for yourself. Nobody ever said it to me.
Does more need to be looked into chronic pain, more alternatives?
Absolutely.
Medical marijuana, possibly at least
I saw your
studied.
show on this, and I think that everything should be on the table. Some things are not going to work, and some things are being driven by a political agenda. But when it comes to treating chronic pain, and I'm not talking about just somebody just
every day, every hour,
and there's no end in sight. Everything needs to be on the table. I mean, for example, my wife's health and care program will pay for thousands of dollars of OxyContin, but they won't pay for hundreds of dollars of lidocaine patches. Explain the logic to this. And I could go down the list of things such as this. In fact, one of the reasons I'm with you right now is because I had to move around appointment to go see her pain specialist so we could go take her to this, because he and I have this regular conversation. It is a very difficult issue for family
And you talked about dealing with opioids, even the lowest dosage possible to remedy the pain. You still have behavioral changes, all kinds of changes, all kinds of side effects that are notorious with opioids.
There are three scenarios with opioids that will affect a caregiver. One, when the doctor overshoots it and they're over-medicated. One, when he or she undershoots it and they're under-medicated and they're in a lot of pain. The other one's when they get it right, because you're still introducing behavior-changing drugs into a human being over a long period of time, and it will affect the entire family, every relationship, your job, everything will be affected by this.
Talk about how important it is for caregivers for this to be a team effort with government funding and government entities, physicians, the clergy, everybody involved in this.
All hands on deck. If you have a platform, use it to say, caregivers, get some help. You don't have to spend a lot of money on this. Just raise your hand and say, I need some help. That's the first step. That's why I do a radio show. That's why I write books. I'm doing these things to let caregivers know that as you push that wheelchair, as you stand in the hospital room corner, your health is important, your emotional health and your physical health, because if you go down, who's in line behind you to take care of this loved one?
And people may not realize this, but at some point in our lives, we're all going to be in the position you are in, whether we're the person needing care or someone in our family is going to need care. In some regards, this affects all of us.
If you love somebody, you're going to be one. If you live long enough, you're going to need one. We all have a stake in this game. And yeah, it's a slow burn, and it doesn't get nearly the kind of coverage that some of the other things do. However, it's affecting more than 65 million Americans right now, and the numbers are going to grow.
What's your message out there for folks in your predicament, in your situation, a dedicated caregiver fighting through this and maybe doing it in the blind, maybe doing it in the shadows where people don't see the hard work and dedication that's going on?
That's the driving force behind everything I do, is that person who is toiling away in obscurity, and sometimes they've lost themselves in this, and I want to help give them a well-lit path to a place of safety where they can just catch their breath, take a knee, and then we're going to devise a plan to help them navigate through the difficult swamp that is caregiving healthily and survive this thing and thrive in it. You don't have to be miserable. I mean, you really don't. Pain is unavoidable. Misery is a choice.
closeted issue that needs to come out in the daylight. Peter Rosenberger, author of Hope for the Caregiver. Appreciate very much your time and your insight. Thank you.
Absolutely. Thank you, Bob.
Stay with us. This week continues in a moment.